Hi, how are you doing? In today's video, I want to show you 4 simple exercises to slow down and improve knee osteoarthritis. And if you don't know me, it's a pleasure to meet you. I'm Dr. Alexandre Mota. I'm a physical therapist and osteopath, and it's great to have you here. Take a look at this question. Dr. Alexandre Mota, I have knee osteoarthritis and inflamed menisci. I always do stretches, but the next day it feels like something is being crushed at the back of my leg. I'm not sure if I explained it well, but I would be happy if you could guide me. Osteoarthritis is one of the most common topics. I get a lot of questions about it here at the clinic, as well as on Instagram and here on YouTube. But I see that a lot of people don't even really know what osteoarthritis is. Whether it's an inflammation, whether it's something that goes away quickly, whether only surgery can fix it, or if there's a medicine you can take and the osteoarthritis just goes away. Let's go. Osteoarthritis is another word for wear and tear. You know the sole, like on your sneakers when you walk a lot, or your flip-flops, you see that it gets more worn out. And depending on the quality of the flip-flop and the way you walk, it wears out more on one side than the other. The shape of the shoe sole changes as it wears down. It's the same thing that happens with the knee. Look, here we have the knee represented, the femur bone from the thigh, and the shin bone, the tibia. Notice that they have very smooth surfaces which fit together and slide. As it starts to wear down, what happens is that this area here stops being smooth and starts to have these rough spots. It starts to get uneven, okay? Both on the thigh bone and here on the tibia bone. This kind of wear, this loss of shape here is osteoarthritis. I only understood it now. I only understood it now. So it's because of this loss of shape, this wear and tear, that osteoarthritis symptoms occur, which are pain, of course, because it's wearing down, sometimes almost getting to the point where bone is touching bone. That little feeling that starts like there's sand in the joint, then turns into crepitus, then into cracking sounds, and sometimes even that sensation of the knee locking up. And swelling can also happen, what we call joint effusion or water on the knee. Ouch!
Alexandre, if it's worn out, you just replace it, or if it's the other knee or you're born again, it's just age-related.
Calm down, it's not quite like that. Think about it with me. If it were just an age thing, young people, people who aren't overweight, they wouldn't have osteoarthritis. Isn't that true? If that were true, everyone of a certain age would have osteoarthritis, but we know that's not the case. We know people who are already advanced in age and have no knee problems at all, and there are people who are still teenagers and already have wear and tear, already have this osteoarthritis. That's true. What happens most of the time is a mechanical overload, too much movement. It's when you're moving one part of the knee too much, either the inside or the outside, and it's this imbalance, this misalignment that results in the wear and tear.
But then how do you make it better?
It's simple. We improve knee alignment and balance movement. Think about it with me. If my knee is misaligned, unbalanced, and causing osteoarthritis, to make it better, I need to improve my hip, I need to improve my ankle and my foot. And lastly, the knee itself. When I create better balance and free up the movement in all these joints, my knee stops overusing the outside and the inside part of the knee. It stops putting strain on the meniscus, stops putting strain on the patella. And then these osteoarthritis symptoms decrease and you slow down the progression of osteoarthritis. Oh my God! No! In fact, I've already recorded a video showing how to improve your knee by working on your thigh. I'm leaving it here on the card for you to watch later. So, the 4 exercises I'm going to show you now are: first, to help you improve your hip movement; second, to improve your foot movement; third, to improve your ankle movement; and finally, to improve your knee movement itself. By the way, I want to know from you, besides knee pain, is there any other area here that's bothering you? Leave it here in the comments so I can help you better by replying to your comment or recording a video answering your question, just like I'm recording this one. And of course, so you don't miss your answer, don't miss out. Subscribe to the channel, turn on the notification bell, and select all notifications because I'll answer your question and YouTube will even let you know when I'm responding. Isn't that cool? Isn't that convenient? So in the first exercise, we're going to improve the movement of the hips. A simple way to do this is to use one of those swivel chairs if you have one at home. It doesn't need to have wheels, okay? It just needs to swivel from side to side. You're going to do it like this. Sit comfortably with your back well supported against the backrest of the chair and keep your feet firmly on the floor. So it's a great idea. If your chair is too high and you can't touch your feet to the floor properly, lower it a little or put something under your feet for support. With your feet fixed on the floor, you're simply going to move your body from one side to the other. When you do this movement, you're rotating your thigh bone. In other words, you're stretching the muscles in your hips, you're lubricating your hip joint. And for your knee itself, you're already helping, as if you were opening and closing the outside and inside of your knee. This simple movement is great for improving hip balance and it's great for improving the movement of your knee itself, especially if the meniscus is involved, like in today's question. And you're going to do this relaxing movement without rushing for 30 seconds. And if you don't have a chair at home, that's not a problem. You can do this same exercise lying on the bed or on the couch. So lie on your side with your legs bent and you're going to do the following movement. Move your knees apart, pointing your knee toward the ceiling as far as you can, as far as is comfortable. Then return and move your heel away and return. This is the same movement you were doing in the chair, except here you're doing it with one leg at a time. A good tip is to place your hand on your waist to prevent your hips from rotating forward or backward, or your torso from rotating as a whole. Keep your hand here so your hip, your pelvis doesn't roll. Lift your knee, lift your heel. Lift your knee, lift your heel. That's one movement. You're going to do 10 with each leg, and to do it with the other leg, just lie down on the other side. The second exercise is for the foot and the third exercise is for the ankle. So you're going to sit down, cross your feet here. Be careful not to rest your weight on your foot, okay? Rest it here above the ankle to keep your foot free. With one hand you hold the ankle here, grabbing the heel, and with the other hand you support the top of the foot from underneath. And here you're going to make these movements as if you were twisting. One hand goes one way and the other goes the other way. Twist to one side, twist to the other, twist to one side, twist to the other. You're going to do this movement here for 30 seconds. Be careful not to push it to the point where it hurts, okay? Do this movement only as far as it's comfortable for you. And here we go straight to the third exercise, which is to improve ankle movement. In the third exercise, you're going to hold above the ankle, above this little bone here, which is on the inside and outside. Grab your toes and you're going to make this movement here as if you were drawing a circle. Remember to move only as far as it doesn't cause pain. You can do 10 circles in one direction and then 10 circles in the other direction. This hand here above the ankle keeps the leg from moving, all right? And notice that this isn't a stretch. I don't have to force it to stretch too much. I just need to make a big circle. 10 times in one direction, 10 times in the other. And the best movement, the best exercise I know to improve the knee joint, to improve the movement of the knee, especially the movement of the menisci, is this exercise. You will sit with your foot resting on the floor, lift the front of your foot, lift your toes and keep your heel on the floor. And you will do this windshield wiper movement outward and inward 10 times very slowly. Make sure to put effort when you pull your foot inward. Again, every time you bring your foot inward, really focus on that movement. Move the foot outward, then really focus on bringing it inward. Really focus when bringing it inward. Do this 10 times without rushing. And these are some of the exercises that are part of the Shodo knee method. If you don't know it, it's an online program for you to improve your knee health, preventing problems, slowing down wear and tear, and of course, learning to control pain with simple exercises. If you want more information to know how it works or to participate and get the shadow knee method, the link is in the description here in the video. And now I want to hear from you. Did this video help you? Did you learn something new? So click the like button here to thank me, because your like will help you, it will help other people, and it will help our channel. And this channel is ours. I want you to share this video and all the others from the channel to help those who are in pain. Help the people you care about to stop taking medicine on their own, thinking there's no other way to relieve the pain. And up here I'm leaving a live stream I did, giving tips about knees and answering questions live. Just click and watch. Down here there's a complete playlist about knee pain. If the video is there, it can help anyone who has knee pain. I'll stop here, a big hug, and see you next time.